Hello, I'm Andrea Shepperson, lead dentist at City Dental at Quay Park. Welcome to our practice. It's a real pleasure to meet you if you're here for the first time, and wonderful to see you back again if you're part of the City Dental family. If you're new to City Dental at Quay Park, you'll find that this experience is a little bit different perhaps to anything you've ever encountered before. Our entire strategy is built around risk assessment. What does that mean? Well, I spent the last 10 years doing postgraduate education in the United States, and the risk assessment philosophy comes out of the Quay Centre, a very prestigious postgraduate training institute based in Seattle and run by Dr. John Quay. Dr. Quay is a futurist and a global leader in dentistry, and so I've adopted the philosophy of the Quay Centre and put it into place in my practice here in Auckland. So risk assessment means that we're taking a look at three things: your past, your current state of health, and making some predictions for the future based on disease activity and what's gone before in your mouth. I guess oral health is a dynamic thing because as we're aging, so many things are changing. And so we're constantly reviewing that risk with you. For those of you who've had our dental fingerprint exam, you'll understand that experience. For those of you who are about to experience it, it probably will be the most comprehensive examination of your life. And we're looking at 5 key areas of the mouth. First of all, oral cancer and medicine. Is there anything in your medical history? Is there any risk of oral cancer? A growing risk actually these days globally, and particularly amongst men under the age of 40. Gums and bones. So do you have any genetic predisposition or clinical manifestation of gum disease, or is there any signal that gum disease is going to be a problem for you as you're aging? What about tooth decay and strength? So if you've got active decay or active tooth surface loss, sometimes that can be from acid erosion, then we'll pick that up when we look in your mouth. Teeth that have been heavily filled over the years are often structurally compromised, and we'll talk about ways that you can protect your teeth from things like fracture and failure going forward. We look at your bite and your jaw joint. How well are you functioning? And is the way your teeth connect on a day-to-day basis during functional activities having an impact on tooth wear, for example, or your general facial comfort? And what about your smile characteristics? How do you feel about the appearance of your smile? This is something that you want us to look at in particular and address, and what are the ways in which we can help you? So like a fingerprint, which is unique, your mouth is unique. Nobody else has a mouth quite like you. And so when we're looking at you, this is a very customized assessment and a customized treatment plan. We understand that everybody has a completely different need. And so sometimes people have the capacity or the desire to do dentistry in a certain way, and sometimes that's impossible. So one of the things that we do is we accommodate your needs on many levels, both in terms of time, in terms of comfort, fear and anxiety, and also in terms of cost. And we'll happily talk to you about ways that you can achieve optimal health for the future and prevent dental disease as you're aging in ways that fit for you in your lifestyle. We hope that you'll enjoy meeting some of the other team members. I'm really, really proud of my team. We're very committed to creating an exceptional experience for you as a patient. At any time, if you have suggestions or ideas or things that you think that we could do differently, we would be delighted to hear from you. So please feel free to raise those issues, and you can email us anytime or discuss these with us in person.